Nursing assistant burnout is not just a personal struggle for those in the profession. It is a systemic issue with far-reaching consequences that affect healthcare workers and the patients who depend on them. Nursing assistants play a critical role in maintaining the quality and efficiency of healthcare systems. Yet, the physical and emotional toll of the job often goes unnoticed or unaddressed. The pressures of understaffing, long shifts, and exposure to trauma create a perfect storm, leading to burnout that compromises the well-being of caregivers and the safety of patients. Nursing assistants are the backbone of patient care, providing essential support in hospitals, long-term care facilities, and rehabilitation centers. At Trinity Health, where I work, our mission is to deliver compassionate, high-quality care to patients, a mission nursing assistants uphold daily. Our role goes beyond routine tasks. We are vital in fostering patient recovery and maintaining their health. To fulfill this responsibility, our community relies heavily on intercommunication through tools like shift reports, care plans, and electronic health records. These tools ensure that information about patients' needs, progress, and treatments are shared among caregivers to prevent big mistakes that could potentially hurt the patients. We also use specialized terminology to communicate efficiently, including terms like ADLs, which are activities of daily living, transfer, PRN, which is as needed, NPO, which is nothing by mouth, and many others. This shared language allows us to operate as a cohesive team and ensure that care is both timely and precise. Becoming proficient in this role requires rigorous training and extensive hands-on experience. Nursing assistants must be adaptable, ready to handle diverse patient scenarios, and equipped with both physical and emotional skills to manage the challenges of caregiving. Despite our dedication and critical role in the healthcare system, burnout is an escalating issue within our community. This ongoing problem not only jeopardizes the well-being of nursing assistants, but also compromises the quality of care that patients receive, making it an urgent matter for healthcare professionals to address. Burnout among nursing assistants has been around for a long time. It's a serious job-related condition that can have major consequences for nurses and their patients. Unfortunately, burnout in nursing is on the rise, making it more important than ever to understand how to manage and prevent this condition. It's also important to remember that burnout is a result of working conditions, not a failure or lack of compassion or work ethic on your part. According to ANA Nursing Resources Hub, almost 2/3 of nurses experience burnout. It is especially common among younger nurses, with 69% under 25 reporting burnout. Nursing assistant burnout is a critical issue with far-reaching consequences for caregivers, healthcare institutions, and patients. For nursing assistants, burnout leads to chronic stress, emotional exhaustion, physical injuries, and high turnover rates, making it difficult to sustain a career in this field. Healthcare facilities suffer from staffing shortages, increased costs due to recruitment and training, and decreased team morale, all of which hinder the ability to provide quality care. Patients are directly impacted, as burnout increases the likelihood of errors, neglect, and subpar outcomes. Factors such as understaffing, emotional strain, and low wages create a vicious cycle that undermines the entire healthcare system. Previous attempts to address burnout have included employee assistance programs and wellness workshops. However, these solutions often fail because they do not tackle the root causes, such as understaffing. One-time wellness programs may provide temporary relief, but do not address the ongoing physical and emotional demands of the job. If nursing assistant burnout continues to go unaddressed, the healthcare systems will face severe staffing shortages as more caregivers leave the profession. This will lead to a decline in patient care quality, increased medical errors, and longer wait times. Healthcare costs will rise due to frequent staff turnover and recruitment efforts, and the morale of remaining staff will decrease, creating a ripple effect across the entire system. Ultimately, the safety and trust of patients and families will be compromised, which jeopardizes the integrity of healthcare delivery. Burnout among nursing professionals is often the result of a combination of demanding work conditions, heavy workloads, and long shifts. Nurses are frequently scheduled for extended hours, working nights, weekends, and holidays. These prolonged periods of physical and mental exertion can lead to chronic fatigue, leaving little time for recovery. Nurses care for patients experiencing pain, suffering, or end-of-life transitions. While these situations are part of the profession, the repeated exposure to such emotionally charged circumstances without proper outlets or coping mechanisms can take a huge toll. I would like to share my experience with working in a long-term care facility. With the baby boomer population increasing in age, the demand for increased staffing levels is more and more important than ever. As you can see by the staffing level chart that the 2020 pandemic negatively impacted staffing levels, putting more workload on the existing staff that remained. The lack of wage increases and the ability for people working from home has resulted in a 52.1% turnover rate, further exacerbating burnout. Amanda Lezuch, a nursing assistant for Corewell Health, says that
I think the main causes of burnout are mainly when nursing facilities like understaffed. You don't see it so much in hospitals, but especially in like nursing homes.
collaboration and teamwork can help create a positive workplace culture. When employees work together, they can share their knowledge, skills, and expertise to achieve common goals. Open communication and feedback can help staff feel heard and valued. This can be done by having regular team meetings and suggestion boxes. When employees feel heard, they are more likely to be engaged and committed to their work. Stress reduction programs and resources can help staff to cope with stress, improving well-being and enhancing their productivity. Nursing assistant burnout is a systemic issue that impacts caregivers, patients, and the entire healthcare system. To ensure sustainable, compassionate care, we must address the cause of burnout, such as understaffing, long shifts, and emotional strain. Nursing assistants play a critical role in patient outcomes, and supporting their well-being is essential for maintaining the quality of care. 3 proposed actions to reduce nursing burnout is first, reduce turnover through increased wages. Second, state legislation for standardized nurse-to-patient ratios. Third, identify supplemental employees like recent retirees to allow for vacation and training of the full-time staff. By implementing meaningful changes to workplace conditions and fostering a culture of support, we can protect these vital workers and improve healthcare for all.